I treat the shoulder and elbow, so that could be trauma, like a broken bone, that could be a sports medicine type minimally invasive surgery like a rotator cuff tear or instability surgery, or that could be arthritis, something like a total shoulder replacement, or everything in between. And that encompasses both surgical treatment as well as non-operative treatment like injections and supervising physical therapy. At Duke, I was doing about 200 shoulder replacements a year, which put us in the highest percentile of all shoulder surgeons in the world. There's excellent evidence that volume correlates with outcome, both in terms of satisfaction with the shoulder replacement, but also in terms of avoidance of complications. And then at Rush, it's been fantastic to both maintain and sustain that volume as well as grow it, and then have a team around you of nurses, anesthesiologists, et cetera, that are also used to a high volume shoulder replacement practice. I love seeing happy patients. Oh, doc, I can do X, Y, Z that I couldn't do before. The pain that I had before is gone now. Look at what I can do now. Here's a picture of me doing something fun with my family. I mean, all those things really drive me. We feed off their energy and their positive outcomes, so being able to deliver that to them and then they share it back with me is absolutely the fuel for the fire that keeps us going.